Dear audience, I would like to present to you the hormonal and non-hormonal treatments for oncological and emergency contraception cases. My name is Lotti. I am an MD PhD student and a 6-year medical student and the last presenter before lunch. And I think it's really important to have women in various gynecological difficulties, and that is why it is really necessary to provide the best therapeutic solutions and best scientific knowledge to these patients. Yes, and my specific goals is two important gynecological issues, such as the vulvovaginal atrophy and the emergency contraception. My first topic is investigating the effectiveness and safety of the treatment of vulvovaginal atrophy in women with breast cancer treatment. We know that breast cancer is the most common invasive cancer in women, which means that there are 2.3 million new cases in every year, and this is a really high number. And we know that the treatment-induced vulvovaginal atrophy are affected many postmenopausal and premenopausal breast cancer survivors, and it causes really bad symptoms, such as dryness, burning, dyspareunia, and bleeding after sexual activity. And it reduces the quality of life. But there are some treatments for these symptoms, and there are hormonal and non-hormonal, such as vaginal gel and carbon dioxide laser therapy. But the missing link is the adequate treatment and patient management. So our aim is to investigate these treatments and provide the best solution for breast cancer survivors. Our hypothesis is that vaginal atrophy caused by breast cancer treatment can be treated to a large extent with hormonal and non-hormonal treatment, but really important to mention the clinical implication, which is we can provide better quality of life for breast cancer patients. We did the systematic search, and in the flowchart we can see that we could collect the data from 19 articles. In the first forest plot, we can see the primary outcome, which is vaginal health index, and it means that it's a score system with we can define the degree of vulvovaginal atrophy. And it means that the lower value we can see before the laser treatment, we can see this lower value, which means that it was really bad condition of vaginal health. But after the treatment, we can see higher numbers, which can result better quality of life and the effectiveness of laser therapy. The second outcome is FSFE, which is Female Sexual Function Index Scoring, and it's a multidimensional self-report instrument for the assessment of female sexual function. And with these, we can see that after the treatment, these patients were more satisfied because we can see the number are growing and it's really good for vaginal health and the satisfied patients too. The third outcome is the pH, and we know that the vaginal pH, the normal value of vaginal pH is between 0.8 and 5. And we can see that after this laser therapy, the values were closer to the normal value than before. And it can result really good effectiveness of the laser therapy. In this plot, we can see the changes in dyspareunia. Dyspareunia was measured by visual analog score, which means that 1 is the best and the smiling face, and 10 is the worst, such as giving birth or runny nose and cold by men. And we can see that after the treatment, patients were more satisfied. And they give a lower number, which means that it results better vaginal health and less symptoms. So, yeah. The next outcome is the dryness, and it's the same. It was measured by visual analog score, and here we can see that in every study we can see a lower number after the treatment. Our conclusion is that significant reduction of clinical symptoms after the treatment and the improvement in vaginal health among breast cancer survivors. The most important clinical implication or practice implication is that really important the early intervention, because it can decrease the decline in sexual function in time. And sexual function in the treated women have a positive impact on the quality of life. And the implication for the research is that we need more RCTs for the higher level of the evidence, and the long-term effects of the use of these different technologies on vaginal tissue should be investigated more. Yes, we started to write the manuscript, and I would like to say something about the second project, which is the investigating the effectiveness and safety of IUDs in emergency contraception. We know that almost half of all pregnancies are unintended in the US, and it's a really huge number, and almost half of these pregnancies ended in abortion. And we can see that in Hungary it's a really big problem, because there was 33 abortions per 100 live births. But we have a solution for this unintended pregnancy, which is the emergency contraception. And we know that the most effective emergency contraception is the intrauterine device, but the most commonly used is the progestin-only pill. The missing link is the evidence of safety and efficacy of IUDs as emergency contraceptives. That's why our aim is to investigate the safety and efficacy of these solution. Our hypothesis is that IUDs in emergency contraception are as safe as oral contraceptive pills, and important to mention the clinical implication, which is we can achieve more personalized emergency contraception. We did the systematic search, and we have expanded the number of the selectable studies. And here we can see that we could collect data from 33 articles. And here we are working figure and tables. In summary, we are making progress with both projects. In the first, we are on the manuscript phase, and with the second, we will get there in a couple of days. And as closing words, I would like to present my third unofficial project. This is the 5 phases of getting a PhD from the perspective of an MD PhD student. The first are the power and excitement. We are strong, like rock, and we are hardworking, and we can do everything. But the second is a question that we repeat more and more. That's why. Why am I here? Why could not make any progress? And yes. The third is the terminal weakness, and we got some hypertension, and we are really sad with our projects, but there are solutions, and we got the 4 ascension, because we got support by the supervisors and by the statisticians, and like the creation of Adam, we give life to our scientific work, and we improve the science in the clinical practice too. And the last phase is the victory and successful PhD. Yes, maybe we are a little bit old, but we will get these science too. So thank you for your attention.
Yes, I would like to ask regarding the first topic, first project. What was the general follow-up period to check up the symptoms after laser therapy for a woman with vulvovaginal atrophy?
In general, that was 1 month, but there are some articles with 3 months follow-up. it's really hard because breast cancer survivors, it's a really hard population, and I think it's hard to achieve them and make some more follow-up. But there are some goal that maybe we need more time to follow up. So yes, but 1 month is always, but there are some 3 months too.
Yes, we know that this therapy we have to repeat. It's not a question, but I would like to ask, is there any information about that? Can we reach a late effect with laser therapy for 1 year, for example?
Yes. Sorry, could you repeat that? Because
we know that this treatment we can repeat.
Mm-hmm.
And is there any literature data, maybe that after 3 treatment session,
mm-hmm.
can we reach something late effect on with this therapy?
Yes, the late effect is that the better vaginal health, and in every occasion it will be more and more healthier and the more satisfied patients. But I don't know about the negative effect, just the positive effect.
I just have one question regarding your primary outcome, the vaginal health index. I saw the mean difference was about 11 to 12 in 3 studies and around 4 to 5 in the rest of the studies. Have you investigated the reason behind that?
One moment.
Yes.
Yes.
Like what was different in those studies where the mean difference is around 11 or 12 and the rest around 4 and 5?
Mm-hmm.
So maybe it's worth investigating or maybe making some subgroup analysis based on that.
Well, I will look after that because I don't know that. Yeah, maybe we can do more subgroups, and yes, it can be a good solution.